Today, we are going to learn about the routine care of the newborn baby. The objectives of this session are to explain the need for counseling mothers to take care of the baby in the initial few days after delivery, to describe evidence-based daily care of the newborn baby, and further to describe the components for counseling the mothers regarding how to look after the baby and to identify the danger signs and seek help early. All mothers need help, support, and advice in the initial few days after delivery to ensure proper care of their newly born babies. This help and care is critical in maintaining the normality and preventing any complications both in the mothers as well as their newborns. Why do mothers need help in the initial few days of delivery? Ideally, all pregnant women should be counseled regarding the care of the baby during the antenatal period itself to help them be mentally prepared to take care of their babies after birth. After delivery, majority of the mothers usually stay for a very short time in the hospital. During this short period, they need time to get to know their babies, to rest since they are often tired and exhausted after delivery, to know what care has to be given to the baby and how to carry out that care, to know what to do if the baby is not well. Therefore, it is important for the healthcare providers to help the mothers, whether at a health facility or at home, in this crucial time period. Primary mothers often need more help and support for the proper care of their infants. Routine care after birth. There are 4 major domains in the routine care after birth. They are providing warm, appropriate, and safe postnatal environment to the mother and baby, providing everyday care of the baby, which includes breastfeeding, warmth, care of the cord, and maintaining hygiene, looking for danger signs and seeking help and treatment early, and preparation for discharge so the mother is confident and competent to provide care to the baby at home. The postnatal environment. A postnatal room should be kept warm with no drafts of air from the open doors or windows. A temperature of at least 25 degrees Celsius is required to keep a baby warm. Often, a radiant heater, blower, or other devices for providing warmth are necessary to maintain the appropriate room temperature, especially in winter months. Further, a mother and her baby should not be separated and should be kept together from birth, in bed or very near to each other. This helps the mother to get to know her baby and form an early, close, loving relationship, and to respond quickly when the baby wants to feed, which helps establish breastfeeding. A bed net may be used to prevent a mother and baby becoming ill from diseases spread by mosquitoes and other insects, such as malaria. Everyday care of the baby. Everyday care refers to care needed by all newborn babies after the first few hours of birth till the time of discharge from the health facility. The 4 key elements of this care are continuing breastfeeding, ensuring warmth, providing cord care, and maintaining hygiene. These needs are same for babies born at home. It is the duty of healthcare providers to ensure that each baby receives appropriate care irrespective of the place of delivery. To support mothers in breastfeeding their babies, health workers must be both skilled and knowledgeable. Inform mothers that the thick yellow milk which is secreted in the first few days is called colostrum. The small amount of colostrum secreted, which may be about a teaspoon, is quite sufficient for the baby's needs in the first 2 days after birth. Also inform her that the milk secretion will gradually increase over the next few days. There are some do's and don'ts of breastfeeding. The do's are: mothers should be advised and supported to provide exclusive breastfeeding on demand, day and night. The baby should be fed at least 8 times in 24 hours. The night feeds are very important as more prolactin hormone is produced at night. Prolactin is responsible for milk secretion. So the night feeds help in production of more milk for the baby. In case a mother has any difficulty in breastfeeding, assist breastfeeding and help her with attachment and positioning. You will learn more about positioning and attachment in the session on breastfeeding. Advise the mother to seek help from healthcare personnel if there is a breastfeeding difficulty. The breastfeeding should be assessed again before planning to discharge the baby. Do not discharge the baby if breastfeeding is not established. Remember that no prelactal feed in the form of honey, tea, ghutti, etc. should be given to the baby. As discussed earlier, it is important to practice roaming in or bedding in to ensure successful breastfeeding. If mother has any doubts, misconceptions or false beliefs regarding colostrum or breastfeeding, it should be clarified. Continue to promote early and exclusive breastfeeding within all delivery settings, including antenatal care, at delivery and postnatal care. The next aspect of everyday care is ensuring warmth for the baby. This involves preventing heat loss and maintaining the normal temperature in newborn. Newborn babies are often prone to become hypothermic, which is a very important cause of neonatal morbidity and mortality. A normothermic baby has axillary temperature between 36.5 to 37.5 degrees Celsius and his abdomen and feet are warm to touch. Axillary temperature less than 36.5 degrees centigrade is termed as hypothermia. All mothers should be explained about the importance of keeping the baby warm. Warm change should be maintained from the time of birth and later during transportation and in the postnatal ward. This will minimize the likelihood of hypothermia in newborns. In order to prevent heat loss, the baby should be kept dry and dressed or wrapped in a dry, clean cloth. Care should be taken to cover the head with cap and the feet with socks. The mother should be taught to assess the baby's temperature by touching the baby's feet every 4 hours. If the feet are cold, the baby should be kept in skin-to-skin contact position. The room should also be warmed and baby should be covered with an extra blanket. The mother should reassess the baby's temperature after 1 hour. If the feet are still cold, she should inform the healthcare provider. Further, principles of maintaining normal temperature apply even after the baby is discharged from the health facility. Mother should ensure that the room temperature is kept warm, avoid any drafts in the room, baby is dressed or wrapped properly, his head and feet should be covered. Baby has at least 1 to 2 layers of clothes more than adults. Baby should sleep in the same bed with the mother at night. Special precautions are taken, particularly while bathing the baby and during the winter months. Cold care. A routine cold care in the first few days of the life, that is until the cold dries and falls off, is very important to prevent infection. There are some do's and don'ts to this care. The do's are: wash hands before and after cold care. Fold the nappy, that is the diaper, below the level of the stump to avoid any soiling. Keep cold stump loosely covered with clean clothes. If the stump is soiled, wash it with clean water and soap. Dry it thoroughly with clean cloth. Look for the signs of infection daily. first discharge from the cord stump, redness around the cord, especially if there is swelling, high temperature that is more than 37.5 degrees Celsius, or other signs of infection. In addition, explain to the mother that she should seek care if the umbilicus is red or draining pus or blood. The don'ts are: put nothing on the stump. Healthcare providers should look for any bleeding from the cord, particularly after about 3 to 4 hours of birth. This is the time that the cord shrivels up and the cord tie may become loose. It is important to teach the mother that the umbilical stump should be left dry. They should not apply anything on the stump. Maintaining hygiene of the baby requires mothers, families, and health professionals to avoid harmful traditional practices and to follow appropriate guidelines. There is no need to bathe the baby every day. Baby should be washed only if necessary. Some of the do's are: wipe the face, neck, and underarms of the baby daily. If the bath is given, ensure the room is warm and there is no draft while changing the clothes, washing, and bathing. Use lukewarm water for bathing. Thoroughly dry the baby, dress, and cover after bath. Take extra precautions if the baby is small. Wash the buttocks when soiled. Dry thoroughly. Use cloth diaper on baby's bottom to collect the stool. Dispose of the stool as for women's pads. Wash hands after disposing. However, some of the don'ts are: do not bathe the baby before 20 hours of age or if the baby is cold. In case of small babies, bathe only after the baby reaches a weight of 2000 grams. Do not apply anything like kajal on the eyes of the baby, as it can be a source of infection for the baby. There are some signs in the newborns which are indicators of serious illness in the newborn. These signs are called danger signs. It is important that mothers, caregivers, and health workers are able to recognize the signs and symptoms which indicate that the baby is not well. Early recognition of these signs will help in identifying those babies who need urgent care and treatment. These important danger signs are: not feeding well, no movement, fast breathing that is more than 60 breaths per minute, moderate or severe chest indrawing, jaundice on day 1, or palms or soles stained yellow at any age, abnormal movements, fever that is temperature above 37.5 degrees centigrade or temperature below 35.5 degrees centigrade, or not rising after rewarming. All mothers should be advised about how to recognize these danger signs and to report immediately if their baby develops one or more of these. Immunization. All babies should be given 3 vaccines within the first week of life, preferably before discharge from the health facility. These are BCG, oral polio vaccine, and hepatitis B. Healthcare providers should ensure that the baby gets immunized before discharge, and mother is given an immunization card if available. She should be explained regarding further immunization to be followed as per the National Immunization Schedule. Preparing for discharge. A baby can be discharged from the healthcare facility if the set criteria are met. That is, feeding well. That means a baby is sucking effectively at least 8 times in 24 hours, day and night. Babies who are adequately fed are contented, playful, have good sleep, and are satisfied for at least 2 to 3 hours after a feed. They also pass urine at least 5 to 6 times a day. Other criteria are: the baby has no danger signs. Mother is confident to take care of the baby. Mother understands the need for follow-up and the danger signs as to when to report early. For small baby below 2500 gram, feeding well and gaining weight adequately. Most healthy term babies lose weight during the first 2 to 3 days of life. The weight loss is usually about 5 to 7% of the birth weight. Weight remains stationary during the next 1 to 2 days and birth weight is regained by the end of the first week. Thereafter, the baby gains about 30 grams per day for the next 3 months. Baby should not be on any medications except vitamins. After discharge, the baby needs to be brought for follow-up visits. This is required for assessment of growth and development. The weight of the baby is checked at each visit to see if the baby is growing properly. Normally, a baby would gain about 800 grams per month during the first 3 months. Developmental milestones are checked to ensure proper development. Follow-up is also needed for ensuring immunization to protect against common infective illnesses and early diagnosis and management of the illnesses and to provide health education. At least 3 additional postnatal contacts are recommended for all mothers and newborns, that is, on day 3 between 48 to 72 hours, between days 7 and 14, and 6 weeks after birth. Mothers should be educated about providing exclusive breastfeeding for 6 months and initiating complementary feeds after 6 months and also for family planning. Communication and play for the newborn should be encouraged. Finally, let us review the key messages of this session. In order to promote health and prevent morbidity and mortality among newborns, appropriate routine care is essential. The 4 major domains of this care are appropriate postnatal environment, everyday care of the baby, looking for danger signs, and providing treatment and preparing for discharge. Ensure a safe and warm postnatal environment where the room is warm and mother practices rooming in and provides KMC or skin-to-skin care as needed. For everyday care of the baby, counsel and support the mother to maintain exclusive breastfeeding for 6 months on demand day and night, to keep the cord clean and dry, to maintain hygiene of the baby, and to look for danger signs and identify need for urgent treatment. Remember to prepare the mother for discharge so she can continue to provide care at home and come for follow-up as required. Thank you.